Welcome to our Cumberland County informational session. I'm going to hit the record button. We are recording this session now. It's August the 11th, and we are doing our Cumberland County Monkeypox informational update on behalf of the Cumberland County HIV Task Force and the Cumberland County Department of Public Health. I am going to do a little bit of housekeeping, and then I'm going to turn it over to Dr. Javon McLean for some welcome. If you are joining us, you are muted except for our panelists. So all of you are muted upon entry. We are going to utilize the chat box this afternoon to do our Q&A session, which will be facilitated. And then as I mentioned, we will be recording this session, and we are going to put this on our website. And we will also make sure that you have the slides available. So I'm going to go back one slide while we do that. We will put some links in the chat box for you. So everybody that is joining us today or looking at this in the future, note that these slides are up to date as of August the 11th. If you're watching this afterwards, we want to make sure that you have resources available. So on the next slide, we're going to show you some links that you can go to for up-to-date information, and then we're going to drop those in the chat box for you now so that you have those available to you. All right, and so those websites are going to be our Cumberland County Health Department website, where you can stay up to date with information about monkeypox, our state health department website, North Carolina Department of Health and Human Services, and then our the Centers for Disease Control and Prevention website as well. All right, we have a short agenda for today, just 3 items. We're going to get a welcome from Dr. Javon McLean of our Cumberland County HIV Task Force. I'll provide you some monkeypox updates, and then we're going to do a Q&A session. So I'm going to turn the mic over to Dr. Javon McLean for a welcome.
Well, good afternoon, Cumberland County and all surrounding areas. Thank you so much for joining us today as we have this wonderful discussion and informative discussion on the monkeypox that is going over the monkeypox virus and the monkeypox vaccine and how to bring access to our community. We are so excited today to be on here in collaboration with our Cumberland County Health Department. As she stated, I am the chair of the Cumberland County HIV Task Force. And with that being said, I first of all would like to say once again, welcome, and to extend an invitation to you. If you are a professional who works in the area of HIV or advocates for those living with HIV or prevention, or even if you are an advocate living with HIV, we'd like to invite you to be a part of our meetings. And we are so excited to, once again, to be with you. I ask that you please make sure that you pay attention. Make sure that you grab the links so that when you share out information that you are able to share out credible sources of information, because we don't want to share erroneous information. Stigma is a big thing in our community and in the Deep South anyways, and Lord knows we would not want to perpetuate those stigmas concerning this now monkeypox virus, okay? And so with that being said, thank you so much once again, Dr. Green, for having us today. We look forward to being informed today, and also we'll get a few laughs and giggles here and there when we can. Listen, so enjoy the seminar, enjoy the information that we're going to put out today, and thank you so much once again for joining us. Kick it back over to you, Doc.
And Dr. McLean, can you remind us one more time when those HIV task force meetings are?
Ma'am, thank you so much for asking. Thank you so much for asking. Our meetings with the HIV task force are on the first Tuesdays of every month, unless otherwise stated. We meet every first Tuesday at 12 p.m. for our general meeting. Our executive meeting is at 11:30, and I will actually put my email in the chat, because if you are looking to become a part of the task force, I'll put my email so that you can email me, and I'll be able to send you over an application.
Perfect. Thank you so much. So we also recognize that a lot of you are calling in, which is great. So you may not be able to see the chat box, but when we share out the slides with you and put them onto our website, you'll be able to get all the links that are on the slides today. And we'll also share information about joining the HIV task force. So please look for that on our website. And that will be at cumberlandcountync.gov as you review the slides at a later date. So as I mentioned, we're going to do split the session today. We're going to do about half of our time. You'll hear my voice, Jennifer Green, the director of our Cumberland County Department of Public Health. You'll hear my voice first for the first half of our session, and then we will do some Q&A. I recognize again that many of you are calling in, and so we'll do some either typing in the chat box, or we'll work to get you unmuted so that we can answer some questions as well. And helping me to facilitate our Q&A session will be Alba Natali. She is our communicable disease and epidemiology supervisor here at the health department. And then Randy Nunez is our immunization supervisor as well. So we'll be fielding your questions today, but we will get started with some information for you all first, and then we will shift to our Q&A portion. All right, so without any further ado, I'm gonna see if I can switch my slides around. All right, and then you'll also see me turn my video off, so that helps us to keep the our Wi-Fi going and making sure that we don't have a delay in our slides. So I'm going to turn off my camera and so that we can make sure we have a smooth process. All right, so let's start with some quick background about monkeypox. So this is maybe new for many of you, and many of us maybe are hearing about monkeypox for the first time, but monkeypox is not actually a new communicable disease. It is rare. It's typically found in other countries, traditionally in West Africa and Central West Africa. It's a disease or infection caused by the monkeypox virus. We get lots of questions about whether this is caused by monkeys, and not necessarily. It can be transmitted through rodents or other type or monkeys, but not necessarily. And certainly in this outbreak, this current outbreak that's going on in the United States is not transmitted or being transmitted by monkeys. We're going to talk primarily about the current outbreak that's spreading in our country, primarily because that's what's relevant locally and relevant in the United States. But the current outbreak is spreading not just in the United States, but in countries across the world that don't traditionally see monkeypox. So our outbreak in the United States began on May the 17th. And again, we don't typically see monkeypox. The last time that we had monkeypox in a real way in the United States was back in the early 2000s. The current outbreak is primarily among men who have sex with men. But I want to note and draw upon something that Javon said earlier about not creating stigma. We do not want to go back to the days of our HIV epidemic where we first started and we had a lot of challenges with stigma that still persists today. So that even though nearly all of our cases in the current outbreak in the United States have been among men who have sex with men, it's important to note that monkeypox can be acquired by all people, regardless of their age, their race, their gender identity, their sexual orientation. And that's important because we want to make sure that all of our public is informed. We also want to note who in our community is at higher risk at this time, and who is being most impacted. So we're going to talk about stigma a few times, so you'll hear me say that and call it opportunities to reduce stigma. And then it's also notable that monkeypox has been declared a national public health emergency. So we saw that announcement from the White House a week or so ago. And then also the World Health Organization has declared this a public health emergency. So lots of people ask us about, well, how is this like COVID? What are you all doing? And how is this like COVID? Is this different from COVID? Everybody is still in some ways in COVID mode. So let's do some comparison to how this is similar and different from our COVID-19 response. So just like COVID-19, monkeypox is a reportable communicable disease. So if there is a positive case of monkeypox, somebody is tested and they test positive, that is reportable to the health department. We report that up to our state health department, which gets reported back to the CDC. So it's reportable. So if you are a provider that is listening, please know that you are required to report that to us. Monkeypox does not spread as easily as COVID-19. It's actually pretty hard in comparison to spread monkeypox, but that's going to, and we'll talk about the ways of transmission in just a little bit, but it doesn't spread as easily. So I often get the question, well, should I be worried about somebody that's in the grocery store? And it doesn't spread that easily. And we'll talk about the risk of exposure in just a few slides. Monkeypox is rarely fatal, but that doesn't mean that it's not important. Monkeypox is important because it can cause severe debilitating pain for people that are impacted by monkeypox. So even if you don't pass away due to monkeypox, or even if you're not hospitalized, it can be very painful for those that are impacted. We do have testing capacity. So this is different than when we started with COVID, where we were just developing a test for COVID-19. We have the tools that we need to do to test. I'll note for our providers that are listening, we still need providers in our community that are willing to test for monkeypox. We need to expand that capacity, but we have testing supplies already that we can utilize to test individuals for monkeypox. We do not have a rapid test for monkeypox, so it typically takes a few days to get your test results back. This is not a scenario like we have with COVID now, where you can go to a testing tent and get your results back in 15 minutes or 20 minutes with a rapid test. These are tests that we have to send off to the lab, and we'll get to that in just a few minutes. Just because this is a reportable communicable disease, just like COVID, we do contact tracing and case investigations. Everybody is now an expert on case investigation and contact tracing for COVID. And so you'll hear those terms from us again with monkeypox. For all of our positive cases, we continue to do both of those things. Just like COVID-19, our positive cases are isolated. It looks a little bit different about how long people isolate, and we'll talk about what that looks like later on in the presentation. In addition, we still work to identify close contacts through our contact tracing and case investigation. There's no quarantine requirement for our close contacts, but we do monitor. So we'll talk about that as well. And then the other key part of this, our outbreak response for this particular outbreak, is that we already have a safe and effective vaccine, although it's notable that our vaccine is in limited supply right now. So that's just a little bit of comparison about how this looks for our monkeypox response in comparison to our COVID-19 response. So let's talk about some data. And we'll start with big picture US data, and then we're going to shift to talking about our North Carolina data and our local data. So internationally, you can see the US map on the right-hand side of your screen. And for those folks that are calling in, we're looking at a map that shows by state, and it's color-coded here, by state, how many cases that we have. And so most, but not all states have had at least one case of monkeypox. The states that are highlighted in blue have more cases. So Texas and Florida and California have more cases, partly because of their population size, than other states do. This is some national demographic data. So we often get questions about, well, who's being impacted the most? So the CDC has done some preliminary research about who's being most impacted. It's important to remember that about 99% of our cases so far are among men. Now, this is among cases that have reported data. So not every case is going to share information with us about across the country about the details about age, sex, gender, race, sexual orientation. That doesn't get collected for every case, although we are working to make sure we have robust data. So among the cases where we have data available, about 99% were among men. The average or the median age is about 35. Although, again, we know that monkeypox can happen at any age range. The majority of our cases are among those that identify as white. And then I'll note that we have a disproportionate amount of cases among those that are Hispanic and Black. So in the United States, nationwide, about 26% of our cases are among those that are Black, and about 28% among those that are identify as Hispanic. We often get asked the question about, well, where are people getting monkeypox from? About 3/4 of our cases are what we call locally acquired. And again, that's nationwide, meaning they got it in their local jurisdiction. It wasn't travel related. So they moved, they didn't go to another country and then get monkeypox. They got it locally, which means for us that it's spreading in the United States and is not only travel acquired. Again, this current outbreak is disproportionately affecting gay men, bisexual men, and other men who have sex with men. But again, I'll note that anyone can acquire monkeypox. It does not necessarily only among men who have sex with men. So we're going to talk about that throughout the presentation. So let's talk about what's going on in North Carolina. The state health department has a dashboard. So folks who are familiar with our state health department's website from COVID-19, they are working on a similar dashboard, and they have some preliminary information available now. In North Carolina, we have about 122 cases as of yesterday. That will get updated Monday through Friday on the North Carolina Department of Health and Human Services website. Nearly all of our cases in North Carolina are among men who have sex with men, so that's consistent with what's going on in the U.S. outbreak. About 59%, so the majority, are among 30 to 49-year-olds. So again, consistent with what's going on with the U.S. This next statistic is a little different for North Carolina, and one that we want to pay close attention to. About 70% of the cases in North Carolina are among Black or African American men. This is important because this is a group that is already marginalized, and if we add other pieces to it, like access to vaccines and testing, as we roll out our response, we want to make sure that we are aware of this population, and then making sure we're rolling out vaccines and rolling out testing in a way that is equitable. So you're going to hear us talk about that throughout the presentation, and another reason why we're glad for the partnership of our HIV task force. And about 85% of our cases in North Carolina are among those that are non-Hispanic. So in Cumberland County, we currently have 3 cases. We identified our first case last week. Our case counts are small, so relatively speaking. And so we get a lot of question about, well, can you tell us about the people and the individuals that are being impacted by COVID-19? Can you tell us where they got it from? Can you tell us how many sexual partners did they have? How did they acquire it? One of the jobs that we have as a health department is to protect people's personal health information. So at this time, we're not able to share about people's sexual orientation. We're not able to share about their where they got it, or if it's their place of employment. And that's important as we think about not creating stigma and making sure that people feel safe and comfortable coming in to get vaccines and tested, and that they won't be able to be identified, individually identified. We do report that information up to our state health department. So our data is going to be included in that North Carolina data. So we are reporting it, but we want to make sure we're protecting the identity. When we have that small number of cases, we want to make sure that we're protecting the identity of those that are getting tested and testing positive for monkeypox. All right, so let's talk about how monkeypox is spread. And so for folks that are looking on the screen, we have a little, there's a website link on here as well about where you can actually download similar images. If you are interested in sharing this information out with your own populations that you serve, or your friends or your family, we'll have some websites that you can, our state health department has a social media kit that you can share these on your own Facebook pages and social media accounts. So monkeypox is spread in a few different ways. It's primarily through person-to-person contact. And so it's direct contact with somebody that has tested positive for monkeypox or has monkeypox. And we'll talk about the signs and symptoms in a minute, but typically it's a rash or scabs or body fluid. And so you have to have direct contact with that rash, that scab, those body fluids on that person. So it's not, I'm just in the same room with that person for a brief time. So for folks that think about COVID, the 6 feet for 15 minutes or more, this is much more difficult to transmit. So it's not that I walked by that person in the grocery store or I saw that person across the hallway. It's much more challenging to transmit monkeypox. It can also be transmitted through prolonged respiratory droplets, through prolonged face-to-face contact, or during intimate physical contact, like kissing or cuddling or sex. We often get the question about, is this a sexually transmitted disease? And it doesn't necessarily have to be transmitted through sex only. There are other ways that it can be transmitted. It can also be transmitted through touching items. So if a person that has monkeypox used clothing or linens or towels, and those the infectious rash or the body fluids were on those linens, and then somebody else touched them, it can be transmitted that way as well. And then if you are a pregnant individual, then that the virus can also be spread through to the fetus through the placenta. Typically, people might be familiar with the phrase an incubation period. So this is typically 7 to 14 days. So your symptoms are after infection are going to show up 7 to 14 days, but can be up to 3 weeks. So after you're infected, it can be up to 3 weeks before you start showing signs or symptoms. And we're going to talk about that, what those are in just a minute, but I've kind of given you a little preview of what those signs and symptoms are. And then if you have a flu-like symptom, typically we're going to start to see symptoms like a rash come a few days later. And we'll get to more detail on that in just a minute. Typically, your illness is going to last 2 to 4 weeks. And people are infectious when all the way up from the time their symptoms start, including before they have a rash, until their lesions heal and their new skin forms underneath or their scabs have fallen off. That'll make a little bit more sense on the next slide when we talk about what those symptoms look like. But the important thing to remember is that you can transmit or spread monkeypox as long as you have symptoms. So let's talk about what those symptoms are. You have a list here, and so for folks that can't see the screen, monkeypox signs and symptoms include a fever, a chill, a headache. So sometimes, but not always, monkeypox starts with flu-like symptoms. So a chills, headache, swollen lymph nodes, kind of exhaustion or tiredness. And then again, 1 to 4 days later, you might have a rash that can appear on your palms, or other places, although that may not be in just one location. The rash can be anywhere on your body. And another piece is that it doesn't always start with flu-like symptoms, right? It can start with the flu-like symptoms might come along with the rash, or it may not. So it really just depends on the person. And then again, so shortly, typically people start with the flu-like symptoms, and again, although not always, and then the rash will appear. And then in more recent cases, that rash was the first symptom to appear. So what should you do if you have any of these symptoms? If you have a new or unexplained rash or other symptoms that you might suspect might be monkeypox, then we want you to come get tested. We want you to get tested or checked out by your healthcare provider so that we can just make sure that you are okay. So we get a lot of questions about what does monkeypox look like. And so this is presenting a little bit different than the pictures you may Google or pictures from what you may have seen from previous monkeypox outbreaks. And so, but here are a few examples of what from the CDC of what our monkeypox might look like. So it may start with, again, a rash. You can see these clear or pus-filled bumps on the skin, and it can be on the hand, it can be on the face, it can be on the palm of your hands, it can be in your mouth, it can be on the anal region or the vaginal region. It can be in lots of different areas on the body of where you might see these symptoms. So if you have a new or unexplained rash or see symptoms that are similar to monkeypox, again, we want you to come get tested. And then how can you do that? So if you are worried about monkeypox symptoms, we'd encourage you to contact your healthcare provider or your local health department, which is Cumberland County Department of Public Health if you live in Cumberland County. Or if you don't live in Cumberland County, contact your local health department in the county and the jurisdiction in which you live, and they can assist you with getting tested. So I'll remind folks, you're going to hear us say the phrase a lot: get checked, get tested, get protected. So people will remember from COVID our 3 W's: wear, wait, and wash. You're going to hear us use the phrase get checked, get tested, get protected. So let's talk a little bit about prevention, and then we're going to shift back to testing. So the one strategy to prevent monkeypox is to get vaccinated. And we'll talk more in detail about vaccines in just a little bit. But that is one way to prevent monkeypox. For those people that are exposed, you can reduce your risk of infection if you are vaccinated. And we want to make sure that if you are vaccinated, that you avoid specific activities that might increase your risk for exposure between your first and second doses. And we're going to talk about that in just a minute. Another way to prevent monkeypox is to avoid close skin-to-skin contact with people who have symptoms that are consistent with monkeypox. This is going to be or have a rash that looks like monkeypox. Again, it's harder to spread monkeypox than it is COVID. So we're less worried about the person that you pass in the aisle at the grocery store. But we do want to avoid that skin-to-skin contact with somebody that has a rash that's consistent with monkeypox. We also want to avoid contact with those objects and materials, whether it's towels or bed sheets, that somebody that has had monkeypox. In addition, we want to make sure you're washing your hands. We should be washing our hands anyway, right? We are still in COVID. We're not too far off from flu season. Also good, just personal health hygiene. We want to make sure that we're washing our hands. That is always a good strategy. In addition, again, this goes back to the part about that monkeypox can be sexually transmitted. So we want to make sure, in addition to preventing a lot of other communicable sexually transmitted diseases, that condoms may protect you from exposure to monkeypox. However, this is one is important, that condoms alone may not prevent all exposures to monkeypox. So remember that monkeypox does not just have to be in the oral region or the vaginal or the anal region. It can be on your hands. It can be in other places of your body that condoms don't go. So we want to make sure that condoms are a good strategy to help protect against monkeypox exposure, but it might not prevent all exposure. Another strategy that we want to talk about is to reduce your number of sexual partners. In the same way that we want people to limit the number of sexual partners to reduce your risk of sexually transmitted diseases, reducing or limiting the number of sexual partners that you have also reduces the likelihood of exposure for monkeypox. In some places around the country and around the world, we've seen transmission happening in these closed, very close quarters, like at a rave, a party, a club, where people are wearing maybe minimal clothing and where there's a lot of direct skin-to-skin contact, a lot of close, intimate contact. Those are all risks for spreading monkeypox. So those are the places that are higher risk for spreading monkeypox. And so we want to reduce our risk in those areas. And we'll talk about how somebody that has monkeypox might also help to reduce the risk there. So we want to make sure that we're aware of the risk level in those particular places. All right, so let's shift to testing just a bit. So when do we want you to get tested? So we've already talked about those signs and symptoms. If you have symptoms of monkeypox, including any unexplained or new bumps, sores, blisters, rashes, or pimples that look like monkeypox, we want you to come get tested for that. If you were in close contact to somebody that has been diagnosed with monkeypox, we also want you to be tested. We're going to help at the health department identify who those close contacts are through our case investigation and contact tracing. So those are the folks that we want to come get tested. You can either contact your healthcare provider for testing, or you can contact us at the health department. We are doing those at this time by appointment, so we can make sure that we're prepared for you and to make sure that your visit can stay confidential, and that we make sure that you're taken care of and can receive services that feel safe and comfortable for you. So for folks that are on the phone, that phone number to call is 910-433-3600. We'll get you to somebody that can talk to you about getting an appointment and getting in for testing. For our providers that are interested in becoming, for our providers that are interested or not sure about providing monkeypox testing, we are working very quickly to start some office hours for you, so that you can get up and going with testing, and you can get information from us about shipping and how to perform testing and how to get the results back. So if you're a healthcare provider, please look for office hours coming soon. In the meantime, Ashley, our deputy health director, has put some links in the chat box, but our state health department has several websites available where you can go back and watch a YouTube video about how to how to perform testing. They also have some provider guidance on the state health department's website about how to perform testing. And we are going to provide some local technical assistance for that as well. So you can get some lessons learned from your partners here locally about that. But our state health department has current resources available now if you're interested in becoming a provider that does testing. All right, so let's talk about, we talked a little bit about this at the top, but people often ask us, okay, I got tested, somebody tests positive, then what happens next? So similar to COVID, we identify a positive case. That person is given isolation instructions. So we're going to make sure that they have a place and location to isolate at home. We're going to have them isolate from school and from work until their end of isolation. So this is going to be a little bit different from COVID. Folks are now used to with COVID that you isolate for 5 days and then you're done. The end of isolation for monkeypox is not as clear cut. The end of isolation is going to won't happen until that rash has fully resolved or gone away. The scabs have fallen off, and then there's a new fresh layer of skin that has formed. So we can't give a exact time frame to say you're going to be done with isolation in 2 weeks or a week or 3 days. We just don't know that. It's going to depend on that individual person. Remember when we talked about symptoms, typically lasting 2 to 4 weeks. So that's going to be the isolation time, but it's going to vary from person to person. And then we also do our contact tracing and case investigation work to identify those that have been exposed. We will help with the notification for those that have been exposed. We're going to help monitor those individuals that have been exposed for symptoms. We're going to do that for 21 days. There is not a quarantine requirement for those that have been exposed. If you have been exposed to monkeypox, you can continue your daily activities as long as you do not have symptoms, because this is different than COVID. At this time, the data is telling us that in order to spread monkeypox, it's with somebody that's symptomatic. And so if you are exposed and you become symptomatic, you start developing a fever or flu-like symptoms or that rash, we're going to have you self-isolate if you become symptomatic. But if you are somebody that's been exposed and you don't have any symptoms, we will help monitor you. And then we're going to refer those that have a high risk exposure for vaccination. So we call that post-exposure prophylaxis. All right, so let's talk a little bit about, we've said this before, but it's worth repeating that for monkeypox, that transmission requires prolonged contact. So with somebody that is symptomatic. So again, we're not talking about the person that you saw in the parking lot at the grocery store. This requires prolonged close contact. So the CDC has helped to define this a little bit. So somebody that we consider to be a high risk exposure is somebody that has had unprotected contact with somebody's skin or mucous membrane, and they've had contact with their skin, the lesions on their body, or the bodily fluid from a patient that's had monkeypox. or if they've had contact with those contaminated materials. So somebody with monkeypox use a towel or linens or bed sheets, and the fluid from that skin got on those linens, and then somebody else used them. That's also a way to what we would consider a high risk exposure. Again, we're going to refer all those high risk exposures to get vaccinated. And we'll talk about that in just a minute. And then we have what we call an intermediate risk exposure. So if you were within 6 feet for 3 hours, so again, this is not 15 minutes, it's 3 hours of being within 6 feet for 3 hours or more of somebody that's unmasked or without wearing a surgical mask, we are going to consider that person to be an intermediate risk of exposure, and we'll work with that person to identify if they need to be referred for vaccination. All right, so that's sort of how we do contact tracing. So let's shift gears for just a few more slides, and then we'll go to the chat box and to talk about to do some Q&A. So if you have been exposed, then we want you to come get vaccinated. We have vaccines available, so we're already ahead of the game with this outbreak than we were with COVID. We didn't have vaccines for the first year of COVID. We have vaccines already available. And in Cumberland County, we have capacity. So we have vaccines. They're in limited supply. And so we're limiting those for now for those that have a known or suspected exposure to monkeypox. So monkeypox is, the vaccines are available to do two things. One, to protect against an infection. And we need to get a vaccine out to individuals within the first 4 days of their exposure. So the sooner the better. So if somebody's exposed, we're going to identify that person and then work quickly to get that person vaccinated within the first 4 days of their exposure. And that's why we do, again, that contact tracing and case investigation. And then the second reason that we vaccinate is to reduce severity of disease. So if you get your vaccine within 14 days of exposure, we may not be able to prevent you from getting infected, but we want to reduce the severity of your exposure. So hopefully it will be less painful and we'll have less severe disease. So currently there's a vaccine that we are approved to use. It's called the Jynneos vaccine. Jynneos with a J for folks that are listening. It's a 2-dose series, 4 weeks apart for adults 18 and over. So take 1 dose, come back to us in 4 weeks, and then we'll get you a second dose. Vaccines are free, vaccines are free, vaccines are free, regardless of your insurance status. So we don't want that to be a barrier to care. So even if you do not have health insurance, vaccines will be free for you. Because vaccines are in limited supply right now, we are limiting based on the CDC guidance and our state health department guidance who is eligible to get a vaccine. And so that includes the folks that are currently eligible to get vaccines are those that are at the highest risk for exposure. So that includes anybody that's been in close physical contact with somebody that's had monkeypox in the last 14 days. So if you were a close contact, you are eligible. And then in addition, the following individuals are also eligible. So any men who have sex with men, or if you identify as transgender, and any of the following in the last 90 days, if you've had multiple or anonymous sex in the last 90 days, or you've been diagnosed with a sexually transmitted infection, or you receive the HIV drug PrEP, then you are also eligible for a vaccine. If you fall into that category, we want you to give us a call at 910-433-3600. Again, we will do a confidential appointment for you. We want to make sure that you feel safe and confident coming to us at the health department for that vaccine. And we'll work with you to get screened and then to receive your vaccine. And then we'll ask again that you come back in 4 weeks. There is a treatment option available. It's we call it TPOXX. It's available under a protocol from the CDC that we call a expanded access protocol. We do not have this locally. We have to request that from our state health department. It's from our federal supply, what we call the Strategic National Stockpile. And it's available for treatment of those that have a monkeypox infection. So this is not something that we give before you have monkeypox. This is if you have monkeypox infection, then we will consider this for you as well. It's an antiviral medication that's either given orally or via IV. And then it's available for patients that either have a very severe infection, they're have complications due to monkeypox, or these very painful lesions, or something that involves the eyes, or if you have other risk factors like HIV or pregnancy, those also will be available. So that treatment option, in the recent days, the CDC has worked to expand treatment availability and make it easier for providers to administer this. And so if you are a provider that's interested, we can get you connected with our state health department. All right, so I'm going to quit talking in just a minute, and we'll have about 15 minutes for questions, but I want to give you information about how to stay up to date. Just like COVID, this is going to change quickly over time, and we want you to make sure that you have the most up-to-date information. So the best place to do that at the local level is to go to our website at cumberlandcountync.gov. If you look on our website now, the health department probably has the first 3 or 4 press releases on there. And so that's one place to go, cumberlandcountync.gov. We are on social media. If you look up Cumberland County Department of Public Health on our Facebook page, you can go there. The county also has a Facebook page that's at Cumberland County NC. We also have information up there. And then our staff are on the radio several times a week. And so you can listen to us on the radio where we talk about COVID, we talk about monkeypox, we talk about other health-related information. We are on WIDU on Monday, Wednesday, Fridays at 8 a.m. And then we are also on Goldie in the morning on WFNC on Thursdays at 8:25. And so those are other opportunities where you can hear us talk about COVID and monkeypox and lots of other health things. So we'd encourage you to tune into those stations as well. And then if you are looking for some statewide updates, if you go to ncdhhs.gov, you can also find information on monkeypox from our state health department about their COVID-19 response. Those are the places. And again, I'd encourage you to stay up to date there because this is going to change just like we did with COVID over the course of this outbreak. Okay, I talked for about 40 minutes, and so we want to make sure that you have some time for questions. Again, I have on the line Alba Natali, who is our STD and our epidemiology supervisor, and Randy Nunez, who is our immunization supervisor. So if you have questions, we'd love to hear them. And I don't see any questions in the chat box yet. But if you have questions, please type them in. And while we're waiting for questions, Randy or Alba, do you have anything you want to share that I missed?
Dr. Green, this is Alba. Thank you so much for all that information. I do just want to say to the general public or for anyone who's wondering, here in our clinic, the STI clinic, if there is, once we triage someone and we ask the relevant questions and we feel like it's necessary to test them for monkeypox, we also do differential diagnosis. So we also check for other STIs that can be, that you could have possibly gotten or during that exposure. So we also testing for HIV, syphilis, chlamydia, and gonorrhea. Let's not forget that STIs are still on the rise, and so we want to make sure that our folks know, or whoever's wanting to get tested, that we'll check for everything to make sure that you stay safe.
Thanks, Alba.
And for vaccines, this is Randy. I think you covered it all. Just if people want to call and they've got questions about whether they are eligible for that vaccine, just give us a call, and it is a confidential call, and we'll talk to you about it if you've got specifics that you're not sure about.
I don't see any questions in the chat box yet, but since I have the mic.
Dr. Green, I think some of the issue is that what seems to be the most of us that's on, we're on, the ones of us that are on are the ones that's the panelists. We're on by video and by the WebEx. All of our other participants seems to have called in, is what it seems like we have.
Yes, I can see that. Okay. So what we'll do is if you guys have questions, then you can reach out to us on social media or on our website about that. And then you will be able to see these slides on our website as soon as we get the recording finished and the slide deck up and posted. Javon, can you talk a little bit? I hate to put you on the spot, but because I have the mic, I'm going to ask you, and I know you're adept at this topic. Can you talk a little bit about ways that we might reduce stigma around HIV and monkeypox? Because I think those might be a little bit similar.
Absolutely. I'll come on just for a little while. Honestly, having the conversation about not perpetuating stigma is number one, when we define stigma, we think of stigma as a mark of shame or disgrace. And one of the things that really kind of stood out, of course, is the fact that monkeypox is being transmitted predominantly amongst men who sleep with men of that group of people. And so, with that being said, I was about to say, I want to reiterate, as she has stated, that anyone can contract monkeypox because it is by touch or being in the presence of someone for, the extended amount of time. And so, as a people, I want to just talk to us about not perpetuating the ideas of stigma concerning this virus, considering and this outbreak. Making sure that we remember to, as she stated, and I don't remember the exact three things, but I know she said get tested, and I know she said be safe. And what was one of the other ones? Can you tell me, Dr. Green? It was three things that you said. Yes.
Yes, get
Yeah, get
tested, get
checked, get
checked.
tested, and get protected. Listen, there's and that's the importance to tell people right now is to just get checked, get tested, get protected. And reminding people that this can be transmitted to anyone. I know we're seeing a predominance amongst a certain population. However, it can be transmitted to anyone. And as she stated earlier, that it does not have to be sexual contact. I think a lot of these conversations when we talk about stigma is when we try to pinpoint it to one specific group of people, or try to put our own other thoughts and ideas, and I would like to just reiterate that the importance of what we have going on here is to remember to make sure that you have the proper information, that you are checking the credible websites that Dr. Green shared with us on today, and also as Dr. Alba, and it was one other, Randy Nunez. I think Miss Alba, Natalie, and Dr. Randy Nunez. If you will reach out to them, if you honestly have questions, don't just assume. A lot of things is what happens, especially within our community, is we talk amongst each other, but we don't get proper data. We don't get proper and credible information. We just start kind of talking off of the things that we kind of remember off the top of our head, but not specific information. It is important. As a matter of fact, Dr. Green, you and I will be talking because I seen some money come out for educational stuff for monkeypox, and I was like, whoa, okay. And so we were just kind of, putting our heads together. But you will see this again: the get checked, get tested, get protected. That's the important part that I want to hone in on today. And as it relates to not perpetuating stigmas by grouping this one thing to a certain group of people, because we'll find ourselves in trouble if we only think that it's only affecting this one group of people currently, and we're misinforming people that anyone can be affected by this virus that's being spread. And so that's the little tidbit that I'd like to add in, and I've gotten done there.
Yeah, thank you, Javon. I knew
You're
you
welcome.
did a great job of saying that. Very well put. And we want to make sure, as the health department and the HIV task force, that as we do our outreach opportunities, that we're going to continue to make sure that we're maintaining confidentiality, that we are being careful about the language that we use. And then, but I think it's also important to know that we're going to be clear about who's at most at risk, and we want to be transparent about that. We don't want to hide that, but we also want to make sure that that we are making it safe for people to come get tested, and making it safe for people that want to come get a vaccine as well. I don't see Ashley. I don't know if you're able to check. I don't know that if anybody has chimed in on our social media accounts with questions. Those are most of the things that we've hit several of the common questions. that we often hear about testing and vaccinations. If you are listening from another county and you don't know where to get vaccinated, we have vaccines in Cumberland County. We do vaccinate regardless of your county of residence. So if you live in Durham County or Wake County or Mecklenburg and you're not able to get an appointment, we will vaccinate you here at the health department in Cumberland. We also work with your local health departments to transfer vaccine to them. So the CDC has allowed the state of North Carolina only a few locations because of the limited supply of where you can get vaccine from. And so Cumberland County is a place that has vaccine. Not every county health department has vaccine yet. That's going to change as vaccine availability becomes more widely available. For now, what happens when those counties, other counties need vaccine is we transfer that vaccine to them. Somebody gets in their car and we drive that vaccine to them. And so we want to make sure that we do that. But we will vaccinate regardless of your county of residency. And right now we have capacity and we have vaccine available in our county. So we'd encourage you that if you fall, I'll put those eligibility criteria. We'll go back over those again. But if you are eligible, we'd encourage you to do that. And again, that's for folks that are, if you have been in close contact with somebody in the last 14 days that has been diagnosed with monkeypox, anybody, men who have sex with men, or if you identify as transgender, and then in the last 90 days, you've had multiple or anonymous sex partners, you've been diagnosed with an STI, or you are receiving the HIV drug PrEP or pre-exposure prophylaxis, then you are eligible for the vaccine. We are working on doing some we're working on doing some more social media, so that's a great place to stay up to date. If you are relevant, if you are a provider in our community and you have questions about vaccines or testing, you can reach out to us either on social media, or if you can see the chat box, we have a link in our chat box for that. You can reach out to us for more information about how to get vaccine or how to get to help to build your capacity to be a test site as well. I want to appreciate and many thanks to the HIV Task Force for partnering with us on this event. Thank you to Randy and Alba, who helped to answer some questions for us today. And with that, we will end the webinar. So thank you all for joining us today and much appreciation for your time.